Hey, everybody. This is Dr. Gibbs. Hi, it's good to see you. I today want to do a follow-up on the discussion that I did a few weeks ago about Hashimoto's. And today I want to go over what do we know about whether we can cure or put Hashimoto's disease into remission. But first, if you are listening to this and you're not a physician, please keep in mind that scientific proof is not nearly as black and white as people think. And in order to make treatment decisions for individual people, sometimes we have to consider evidence that's not nearly as absolute as we would like. So this is not meant to be medical advice, and you should consult your physician for any medical issues or diagnosis that you might have. All right. So Hashimoto's disease is the common name for one of the two varieties of autoimmune thyroid disease. It is super common. It affects 15% of all Americans and some 24% of women who also have allergies. It does run in families, but it doesn't have to be. It's frequently the first autoimmune disease people develop when they have the tendency to develop autoimmune diseases. So it's also the most common cause of hypothyroidism, but people frequently don't realize that they have it until their thyroid gland is already severely damaged. Anyway, they present with something else. Like recently, I saw a young lady who was suffering from hoarseness, but also had discomfort when she would speak, which of course activates the muscles that run over your thyroid gland. And then when I did her examination, I found out that she had kind of a rubbery and nodular thyroid gland, which is kind of typical for Hashimoto's disease. She also had, at first glance, seemingly normal levels or maybe even elevated levels of thyroid hormone, elevated within the normal range, not abnormally elevated, but mildly elevated levels of thyroid hormones, and then lower TSH. And, in reality, her numbers were really borderline elevated based on the criteria that I choose for ideal thyroid hormone levels, and her TSH was suppressed. And then when I checked her reverse T3, it was still within that normal range, but quite high in comparison to the amount of total T3 that she had, which is something that I treat when it's symptomatic. Anyway, so let's talk about what that means. So if your reverse T3 is elevated, reverse T3 was initially thought, when it was discovered, it was thought to be an inert metabolite of T4. And, they tested it every way to Sunday to see if it would stimulate metabolism, and it didn't. And they stopped there. But what they did not realize is that reverse T3 is a competitive inhibitor. If you remember your biochemistry, what that means is that it blocks the receptor binding site and cuts it off so that the T3 that you do have will not work. And, that kind of makes sense in somebody who's got elevated thyroid hormone levels and they're already anxious and they're already, heart racing and the things. They don't want a lot of thyroid stimulation. They want to block that. So your body naturally has this as a defense mechanism. The problem is once you have that elevated reverse T3, it's very, very slow to go away, even when the thyroid hormone levels go back down. So a lot of these people, even though their thyroid hormone levels look normal, they have very poor metabolic function because of that reverse T3 blocker. And that's even if they have what looks like enough thyroid hormone on a test. So to find this out, what we do is we check free T3 and free T4 and TSH. And I have gone over in previous lives what I think the ideal levels for those within the normal ranges. And then you also check a total T3 and a reverse T3. And then you do a simple math where you divide total T3, which is the larger number, by the reverse T3, and you get a ratio. And that ratio, if a patient is healthy, is going to be somewhere between 10 and 14. And that's an excellent indicator that their thyroid function is healthy if their levels are otherwise normal. Now, if their T3 is low out of the normal range, T3 is low out of the normal range, or if their T4 is low out of the normal range, then that ratio doesn't apply as much. That's just frankly hypothyroid. Anyway, some people feel better even at a higher ratio than that between 10 and 14. So my little young lady that I saw when we checked hers, her ratio level was 4, which means she may have high normal thyroid numbers, but her I'm looking at the comments. You're welcome, Justin. Thank you for saying that. Her thyroid function is going to be low out of the normal range because of that horrible ratio. Anyway, so how do we treat Hashimoto's? Well, most endocrinologists actually don't recommend doing anything until your hormone levels are really grossly and obviously low and your TH has gone way up past the top edge of the normal range. And then they treat, generally, not all of them, there are some that are starting to be more enlightened. There are generally treating with levothyroxine or T4. And we have discussed before why that alone is frequently not helpful. And I'm going to just reiterate right now, because if you give somebody T4 and they already have high reverse T3, well, T4 is the precursor to reverse T3, and so they'll just make more reverse T3. Anyway, so this is an autoimmune disease, right? So they might tell you to go to an immunologist or a rheumatologist. Well, guess what? They weren't trained in residency or in med school any more than this ENT doctor was trained in medical school and residency what to do about Hashimoto's. As a matter of fact, one of the founding members of my new endocrinology discussion group is a rheumatologist, and she is really loving what she's learning from new endocrinology. So now she knows what to tell patients that get sent to her who have Hashimoto's and how to fix them, how to make them feel better. So when we're treating Hashimoto's, it's important to keep in mind, and about half the people who have it, the problem, which might start after a stressor like a pregnancy, for example, the problem will go away in about half the people as quietly as it started. The other half will gradually end up with worse and worse thyroid function and eventually a defunct gland. The problem is Hashimoto's, of course, causes many of those symptoms before the gland becomes non-functional for a couple of reasons. One is because the antibodies are attacking the gland, which make it hurt and swell. And when it recovers, then it grows nodules. And some people get mistaken for thyroid cancer and end up getting surgery that wasn't necessary. But the other symptoms that people get are because of that elevated reverse T3 that we talked about. So what can we do to increase the chance of getting into remission? Or if you have a strong family history of autoimmune disease or Hashimoto specifically, what can you do that might even prevent Hashimoto's from starting? Well, there's a variety of options for this and a variety of studies suggesting that this can be done, but the evidence is really pretty weak. So the first thing that I recommend is that you need to do some additional labs to make sure that this is indeed Hashimoto's disease and not the more difficult Graves' disease, or a suspicious thyroid nodule or an autonomously functioning thyroid nodule, like maybe a cancer. So you want to test thyroid stimulating immunoglobulin, and you also want to check something called thyroid receptor antibody, because there are thyroid receptor antibodies that stimulate and there are also ones that block. And so you have to do both of those tests. The next thing you need to check for is elevated iodine, because elevated iodine that's taken in with the diet is one of the common triggers of autoimmune thyroid disease, particularly Graves' disease. And it can throw somebody into thyroid storm, which we actually talked about a couple of weeks ago. It is also important to check 25-hydroxy vitamin D. And then supplement this if it's not in a good mid-normal range. Now, there's a recent Harvard study that showed that higher levels of vitamin D can actually prevent autoimmune disease now it was for older people and it wasn't specifically looking at Hashimoto's, but Hashimoto's is really a disease of younger people, particularly younger women. So for more information about that, I actually did do a live a couple of months ago about this seemingly miraculous hormone. Actually, it is a hormone, even though it was named a vitamin. And since 70% of kids who are 6 to 11 are deficient in vitamin D, not just bottom of the range, I'm talking deficient, then it might just be that fixing this thing alone would help prevent a lot of Hashimoto's. That same study also tested higher levels of our supplementation of omega-3 fatty acids, which seemed to also help reduce the onset of autoimmune diseases in older results. All right, so some practitioners, some docs who work on this believe that you can turn off the autoimmune attack on the thyroid or hasten a remission. There were several European studies that suggested that taking selenomethionine 200 milligrams a day specifically stops the production of the thyroid peroxidase antibody in 75% of cases. So my colleagues and I here in the USA have not really found this to be as successful as we would like, but 200 micrograms of selenomethionine is not going to hurt anybody. And there's really no reason not to do it. Now, you do not want to take high levels of selenium because selenium toxicity is a real thing and has problems that I'm not actually discuss here. Sometimes I wonder if our lack of success with this is because of the high amount of toxins in the American diet, such as glyphosate that's banned in Europe, though I really don't have any proof of that at all. Nevertheless, I do feel like a deficiency of selenium can be a trigger for thyroiditis. So a trace mineral supplement that has that in there could be super helpful. There are also some trials that suggest that shutting down thyroid function with prescription hormone may relieve the problem. In theory, if the gland goes on vacation, it's no longer making the thyroglobulin or the thyroperoxidase proteins that have revved up the immune system in the first place. And after a while, maybe 3 years, the clones of the cells that are making those self-reacting antibodies may die out for lack of ongoing stimulation. And then, hey, presto, you're cured. Once again, here, the problem is if you use levothyroxine alone to do this, your patient who already had elevated reverse T3 to begin with is going to feel even worse because that reverse T3 will go even higher. A better plan is to carefully use prescription T3 or liothyronine to replace and gradually reduce the reverse T3 until that ratio of total T3 to reverse T3 is back above 10, and then add just enough T4 to get the thyroid gland to turn off. So lowering the TSH gradually, not all the way to 0.00 negative whatever, but pretty low, so that you stop producing thyroglobulin, which is a protein that's within the thyroid gland that's produced along with the thyroid hormone. And that's what the thyroid antibodies are attacking in the first place. Okay, wait. A lot of people really like Armour Thyroid. So what about Armour Thyroid? Why not Armour Thyroid? Why don't I recommend that? Or natural desiccated thyroid? It has balanced T3 and T4. The problem with it is this. It is made from animal thyroid glands. So guess what? It has thyroid peroxidase and thyroglobulin proteins in it. So then theoretically, this can actually stimulate, you're taking it orally, it could actually stimulate more antibody production, which is exactly what we don't want to do. So the second reason is It may be the right balance of T4 and T3 for some people, but I generally find that customizing the ratio of T3 to T4 is necessary for my patients. So after you do that, after you do this suppression of the thyroid hormones, if you decide to do that, it's important to keep track of the levels of antibodies in your system so you know what's helping or what's not helping. And the labs to follow are the same 7 tests we did previously. And those are free T3, free T4, TSH, total T3, reverse T3, and then thyroperoxidase antibody and thyroglobulin antibody. Okay, so I have a few other recommendations regarding supplements and some other health measures. So remember, autoimmune disease is an inflammatory process, a dysfunction of the immune system that's gone awry. And stress is a huge trigger for these kind of diseases, as it is a trigger for allergy as well, as is inflammation. So you want to eat clean, whole, unprocessed foods. You want to avoid foods fried in vegetable oil that include these processed vegetable oils. You want to particularly, I find that people who avoid spiking their insulin by eating foods made with flour is helpful. If you have any GI upset, rather than suppress your stomach acid with prescription medicines, use a high quality probiotic instead to keep yourself from not absorbing minerals. You also want to keep a regular sleep schedule. Your goal is 8 hours of solid sleep a night, which will be easier to do once you don't have high reverse T3, since one of the thyroid symptoms is messed up sleep. You want to manage your stress using yoga, dance, meditation, gentle exercise, not extensive cardio, which your body perceives as stress. All right. I have a few other simple supplements that I generally recommend. So I made a free supplements guide for you guys that not only has the name and the brand of these supplements, but the dosing schedules as well that I recommend to my patients. Now, I don't sell these supplements, but I do take them as a thyroid patient. So you can scan this QR code to get your free copy of that supplement guide. And I'm just going to go over them really quick, because the mineral supplements are something called CalMag Zinc. And that's a combination of calcium, magnesium, zinc. And when you're taking high levels of vitamin D, you need to be on something with calcium in it anyway. And then Trace Minerals has a small amount of selenomethionine in it, a small amount of iodine, not so much that it's going to trigger a thyroid storm. And so those are very, very important. And then there's a couple more. A good multivitamin containing polyphenols, which are zeaxanthin and, lutein and zeaxanthin, as well as B vitamins, is also super helpful. It should preferably be a yeast-free vitamins. And one of those is polyphenol nutrients by Pure Encapsulations. I really like that one. And then adrenal support may be helpful, because if your adrenals are overactive or underactive for some reason, then adrenal support can help calm them down and lower your stress levels. So the instructions are in the supplement guide for something called Cytozyme AD, which really does have to be taken on a specific schedule to be most helpful. And then finally, something called pregnenolone. I recommend this be taken twice a day. If you're having your period, you can take extra during days 12 to 24 of your period. This is also by Pure Encapsulations, and they are very high quality supplements. Like I said, I don't sell these, but I do take them. All right. Because Hashimoto's has so many faces, there are lots of items on this treatment menu. If you have thyroid antibodies, especially Hashimoto's, I encourage you to explore some of these options. And all right, that's it for now. So I'm Dana Gibbs, MD. I'm an integrative physician in North Texas. I help people address thyroid and other hormone imbalances. If you are a thyroid or chronic fatigue sufferer in North Texas and you want a caring doctor to help you resolve your exhaustion, joint muscle aches, poor sleep issues, and weight gain, come sign up for a new patient evaluation with me now at danagibbsmd.com. You can also sign up for my newsletter at www.danagibbsmd.com to get some hormone tips and notifications each time I do another live. All right. And before we end, I have another announcement. I'm just going to reiterate because I'm so excited about this. The information that I shared with you here and that changed my entire practice is going to be given as an online lecture series by my mentor, totally free. I'm super excited about this. He calls it the new endocrinology. So if you've ever been frustrated, if you're a doc, because you didn't have anything to offer a patient who had every symptom of low thyroid, but normal standard thyroid panel numbers, I have really great news for you. You don't have to stop there. There are evidence-based integrative techniques that you can use to help these patients. And the big problem is these patients really feel betrayed by conventional medicine because they're going online, they're spending thousands of dollars on unproven supplements, diets, and coaching techniques by people who aren't physicians that ultimately don't solve their problem because what they need is hormones. And I'm not talking about woo-woo mind-body stuff. I'm talking about a few extra labs that reveal these imbalances that we didn't learn or get taught in medical school or residency, and prescription medicines and select supplements given in the right order, in the right combination, at the right time to give your patients relief. I will tell you this information completely changed the way I practice medicine. All right, wait, that's not even really strong enough because it completely changed my life because I was one of those patients. I spent my teens and my 20s sick like all the time, sinus infections, ear infections, strep, mono. I was exhausted. I was cold when everybody else wasn't. My hands and feet were always freezing. I never felt rested no matter how long I slept, and I would wake up in the night drenched in sweat. My hair was thin and limp. My eyebrows went away. I had irregular menstrual periods, constipation, memory problems. I was pale. My pulse was low. My heart rate was low. My blood pressure was so low, I would nearly pass out on rounds or during surgeries. So I was textbook low thyroid, except that I wasn't overweight. And I went to my doctor and they said, oh, your labs are normal. Here, take these antidepressants. You know, looking back, I don't even know how I made it through residency. But after I was out in private practice, I was at a medical conference learning about allergy, and I'd actually already heard the lecture before. So I went into a different one. And as I listened, my mind was just blown because they were talking about me. All those symptoms I listed, they had them listed there right on the slide. And they said, you will do better on natural desiccated thyroid or armored thyroid. And for me, they were right because I went to my doctor and I said, how do I know whether this will help me? I know my TSH is normal, but I'd like to try this. And she let me. Thank you. And it was miraculous for me because every single one of those symptoms got better. And so starting that day was when I began looking for explanations for why did this work for me when my thyroid numbers were normal and everybody else, and nobody thought I had low thyroid. So once I learned about these integrative techniques, I started noticing those symptoms in lots of people. At that time, I was still doing ENT. I found another lady, for example, I'll give you another example, of somebody who had chronic sinusitis. And I said to her, hey, you know what? You've got a few symptoms that make me think you might have an imbalance of your thyroid. And we would check that. They would start on the treatment. And while waiting to schedule their sinus surgery, and then the patient would come back 6 months later and say, my sinus symptoms are gone. I don't need that sinus surgery. I feel great. Can I please have a refill on my thyroid medicine? So it was really amazing. Then guess what? I got older, started hitting menopause. My symptoms were back and nothing I tried was working. And so I went back to this same mentor. I took his complete course. And it's this course that I'm talking to you about. It's called the New Endocrinology. combines a better way of interpreting the labs with prescription hormones and select well-proven supplements. It's a really deep dive, and he's been refining it for years. And everything that he was teaching turned out to be right on in my practice. And with this knowledge, you can fix people with chronic fatigue, fibromyalgia, perimenopause, infertility, PCOS, Hashimoto's disease, all this stuff. You can fix these people, and they will be over the moon with gratitude because they've been to so many other doctors. They've been ignored. They've tried stuff from the internet that was bogus. But you, if you'll come and learn this, you will fix those people and you'll have their business and their gratitude forever. And that is priceless. So to learn more about these innovative and integrative endocrinology techniques, sorry, that's a tongue twister, sign up now. The link is on the screen. The live series is completely free, and it starts on September 24th. So if you'll register now, that'd be great. I would love to see you there. Seats are limited. Thanks very much for listening. This has been really long tonight. Sorry about that. Have a great evening. Bye.